New cases of the bird flu have popped up in the Midwest, causing health officials to keep a closer eye on it. Dr. Doug Casper, an infectious disease specialist with OSF HealthCare, joins us now with more. Good morning. How are you?
Hi, good morning. Thank you for having me.
Yes, thank you for coming on and talking with us. So can you tell me first, what situation is being monitored in one of Illinois' neighbor states in terms of the bird flu?
So we're pretty comfortable talking about seasonal influenza. This is something separate. So this is a strain of influenza that has been circulating in wild bird populations for years. There was crossover into chicken and cattle around 2022, and then for the first time there were human cases detected earlier in 24. There's probably about 5 states that have been involved with a total number of cases of about 16 people confirmed to date. What is concerning is that we think the transmission came from animal population into humans, which is not something that we commonly see, and has the potential to really change how we deal with influenza. Now, fortunately, the overall number of cases is very low, and there have been no cases detected yet in Illinois. However, there is a large number of animals that have been infected, and so those that are at particular risk are those that work in industries with either cattle or chickens.
Okay, and I heard you mention influenza. So it is the time of the year where a lot of people are, getting their flu vaccine. So can you tell me, does this cover them from the bird flu too?
Yeah, so the influenza vaccine available currently does not cover the strain of avian flu. However, like I reiterated, the overall number of cases have been very small to date. There is a potential for a supplement vaccine if this became a much larger problem. Now, this is still to say the best thing an individual can do is get the seasonal influenza vaccine, because overwhelmingly likely the strain of flu they will come in contact with will not be the avian flu.
Okay, that's good to know. And so I know that there's a patient in Missouri who was reported to have no known contact with infected animals. So does that bring like an extra layer of concern for bird flu spreading?
Yeah, this is probably the biggest mystery to date, is that the Missouri patient is unclear how they became infected. And then there was some concern that potentially healthcare workers who took care of that patient contracted similar symptoms. So right now that's an ongoing study or investigation by the CDC to determine what happened. But again, it remains very low risk for the general public to come in contact with or become infected with avian flu.
Okay, and can you tell me, how do bird flu cases compare with regular flu strains?
Yeah, so fortunately to date, the people that have contracted symptoms have been very mild. And so most of them reported symptoms because they were under surveillance. They did not develop severe symptoms that warrant hospitalization or poor outcomes. So mild symptoms so far, but it is something that we want to be alert about. Anytime there's a new strain, potentially that crosses over from animals to humans, is always something that's of concern.
Okay, and lastly, so I know that there's a new way for people to administer the flu vaccine at home. So can you tell me more about that?
Yeah, so typically people receive influenza shots, but there has always been a nasal mist that is currently available at multiple markets around our area. Starting next year, that mist can be delivered at home. So you'll be able to order it, it will come to your house, and you can self-administer. And this is particularly valuable for children or those that have an issue with receiving shots or using needles.
Okay. Well, thank you, Dr. Casper, for coming on and talking with us. And we will share more information on our website.